Okay, some students are typing. Very good. In the name of God, today we continue our lectures regarding to the infection. If you remember last week, we were talking about different types of infection. One type of infection is asymptomatic infection. Asymptomatic infections are those ones which infection is there. Infection is in the patient, but there is no signs and symptoms. So patient doesn't have anything to say, doesn't feel any illness, doesn't feel any problem. So infection is there, but without any symptom. When there is no symptom, it is asymptomatic. It is asymptomatic. So it is subclinical infection. We have two types of infection: clinical infection, subclinical infection. If infection is there with signs and symptoms, it is clinical infection. If infection is there but without signs and symptoms, it is subclinical infections. So although infected, the host doesn't show any signs of the disease. In apparent infection, person doesn't seek medical attention. Why? Because the patient doesn't know he has any disease. So when one patient doesn't know illness, doesn't know he is in a problem, so never go to physician and never start any medicine. So it is what we explained last week. Sometimes when we talk about any infection, we use the definition latency. We use the definition latency or latent infection. Latent infection. A latent infection is an infection that is hidden, inactive, or dormant, as opposed to active infection. So we have another definition. Sometimes we use the definition active infection, and sometimes we can use latent infection. So infection is in the body, but it is not in active form. It is hidden, inactive, and dormant. But sometimes infection can show themselves as active infections, where a virus or bacterium is actively replicating and potentially causing symptoms. Latent infections are essentially static. Latent infection is not dynamic. They are in a static situation. In some cases, microbe can periodically become active. So sometimes latent infection, the infection which the causative agent of an infection is hidden and inactive and dormant, maybe after some time show itself in active infection. In some cases, microbe can periodically become active, and sometimes they have the potential to produce a recurrent disease. Recurrent disease. Latent viral infections in humans include herpes simplex virus, HSV, varicella zoster, Epstein-Barr virus, human cytomegalovirus, and adenovirus. This thing was explained last week. So today we want to have an example related to the latent infection. For example, one latent infection is mostly related to the tuberculosis, and we call it latent tuberculosis, TB, or tubercle bacilli, or tuberculosis infection. Sometimes tuberculosis, which is caused by Mycobacterium tuberculosis, is in latent state, latent infection. But sometimes it is active and shows signs and symptoms, and we call it TB disease. So sometimes tuberculosis don't show itself, and sometimes show different signs and symptoms. If it doesn't show itself, we call it latent tuberculosis infection. If show itself with signs and symptoms, we call it TB disease. Not everyone infected with TB bacteria becomes sick. So it means maybe some of us during our life were infected with this bacteria without any signs and symptoms. Not everyone infected with TB bacteria becomes sick. As a result, two TB-related conditions exist: latent TB infection and TB disease. So people are into groups. Those groups which show signs and symptoms, so they have TB disease. And those ones infected with TB without signs and symptoms, they have latent TB infection. So we discussed these two here. Number one, latent TB infection. Tuberculosis bacteria or tubercle bacilli or Mycobacterium tuberculosis can live in the body without making you sick. This is called latent TB infection. In most people who breathe in TB bacteria and become infected, the body is able to fight the bacteria to stop them from growing. So if immune system is powerful, stop growth, stop multiplication of tubercle bacilli, even though they go to a static situation, don't grow, don't multiply, so they can escape from immune system. They are there without doing anything. They are in the body of some people without doing anything. Only they are alive. But there is no signs and symptoms. So it is latent infection. People with latent tubercle bacilli infection or tuberculosis infection have no symptoms, don't feel sick, cannot spread tubercle bacilli bacteria to the other people, usually have a positive TB skin test reaction, or positive TB blood test may develop TB disease if they don't receive treatment for latent TB infection. Many people who have latent TB infection, many of the people having latent TB infection never develop TB disease. In these people, the TB bacteria remain inactive for a lifetime without causing disease. But in other people, especially people who have a weak immune system, the bacteria become active, multiplying, and cause tuberculous disease or tuberculosis. So till this part, you should understand what is the difference between latent infection and active infection. TB disease. TB bacteria become active if the immune system cannot stop them from growing. When TB bacteria are active, this is called TB disease. They may also be able to spread the bacteria to people they spend time with every day. For people whose immune systems are weak, especially those with HIV, human immunodeficiency virus, the risk of developing TB disease is much higher than the people with normal immune systems. Is it clear? Is it okay? Did you understand the difference between latent infection and active infection? Okay. Because some parts are very simple, so I give you less explanation and going more fast for the other parts. But if any part you feel need more explaining, you can ask me. Sequela. Sequela. What is sequela? Long-term or permanent damage to tissue or organs. If one infection is in the body for a long time, and for a long time this infection damaged to tissue and organs of human, we call it sequela. Sequela. What's that? Long-term or permanent damage to tissues or organs. Okay, now we want to receive an example. A typical sequela is a chronic complication. Okay, when we use chronic, two words are coming together, like acute and chronic infections. Okay, acute and chronic infections. See, suppose one pathogen comes to the body of one person. If one infection is in the body of one patient, mostly shows signs and symptoms. So it is acute infection. When you have something to say to the physician, for example, you say, I have headache, I have vomiting, I have fever, I have chilling. So when infection is in acute phase, you have many things to say to the physician or to your family. Many things you have to say. Okay? When there is acute infection, three things may be happening. One thing is that after some time, immune system stop the infection and kill the pathogens. It is number one. What happened? Immune system stop infection and kill all the pathogens. This is good, yes? We like it because we cure and we can continue our normal life. Number two, sometimes pathogen is very powerful and kill the patient. It is opposite situation than before. So number one, immune system kill the pathogen. Number two, pathogen kill the patient. And sometimes immune system and the pathogen going to a balance situation. Immune system cannot completely kill all the pathogens, and pathogens cannot kill the patient. And they are with each other for a long time. For a long time, pathogen has problem, and for a long time, immune system try to remove the bacteria. We call it chronic infection. Chronic infection. So when one infection for a long time is present in the body of one person or one patient, it is in chronic state. It is in the chronic state or situation. And mostly when one infection is present in the body of patient for a long time, sometimes this infection can have great damage to tissues or organs of the body. So what pathogen do? Pathogen use the body as food and mostly damage to the tissues and our organs. So a typical sequela is a chronic complication. So a sequela is in a situation which infection is chronic. It is chronic infection. Infection is in the body for a long time of an acute condition or a long-term effect of a temporary disease or injury which follows immediately from the condition. Like what? Like neurological sequelae, damage to the nervous system, like central nervous systems, and permanent damage to the nervous system in a substantial amount of the patients following bacterial meningitis. So when there is meningitis and the causative agent is bacteria, so if those bacteria are present there for a long time, especially in chronic infection, they can go through the neurological sequelae, means damage to the nervous system. So what happened? Something happens. Most frequently reported sequelae are sequelae regarding bacterial meningitis, are focal neurological defects, hearing loss, cognitive impairment, and epilepsy. So all of them are different damage to the nervous system. Or for example, COVID-19 is also known to cause post-acute sequelae. You know, after acute infection, many problems to the tissues of lung, to the tissues of kidney, to the tissues of heart happening after COVID-19 in most patients, known as long COVID, post-COVID syndrome, or post-acute sequelae of COVID-19, PASC. So now we understood what the meaning of sequelae is. So again repeating, acute disease. Acute disease. When a disease is in acute form, which many signs and symptoms are present in the patient. Acute disease develop rapidly, cause severe symptoms, and fade quickly. Chronic disease linger for long period of time, slower to develop and recede. Numerous chronic diseases are not a direct result of microbial infection. However, certain microbial infections are associated with chronic disease such as chlamydia infection and cardiovascular disease, CVD. So, different types of chlamydia like chlamydia trachomatis and different types of bacteria can be effective on different tissues and the bodies. Different bacterial species related to the risk of cardiovascular disease include, so sometimes heart pain, heart attack, heart problems are related to the bacterial infections. Which bacteria are mostly related to the CVD? Like Helicobacter pylori, which it is present in stomach, Chlamydia pneumonia, and Mycoplasma pneumonia, which they are present in the lung. Porphyromonas gingivalis and Streptococcus mutans, which they are present in the mouth, on gingiva, and on our teeth. And these two last ones are causative agents for dental decay. So, Porphyromonas gingivalis and Streptococcus mutans can be present on the teeth and can be present on gingiva. In which form? They can be on tooth surface and showing pellicle or production biofilm. The microcolonies of bacteria on the teeth we call as the biofilm. We call as the biofilm. So they attack to the teeth in group, and by acid production and many enzymes starting decaying the teeth and using the teeth as their foods. So this is main infection. But sometimes along with the main place of infection, there are secondary involvement also. So these bacteria are present on teeth that can cause cardiovascular disease of heart. So this bacterium, as well as Streptococcus mutans, they produce infection of teeth. But along with this infection, when they are present for a long time on different teeth of the person, can go slowly attack to the heart and produce cardiovascular disease. So one example of CVD is Helicobacter pylori, which is present in the stomach. You know, stomach contains acid, and the only bacterium, the only microbe which can suffer the acidic situation of the stomach is Helicobacter pylori. In many people, Helicobacter pylori is present without producing any signs and symptoms, and those people suffering Helicobacter pylori don't have any problem. But in some people, as it was written by dear student Ode Abdusada, Helicobacter pylori cause ulcer in some patients in the stomach, can be pathogenic. But you can see this microbe present in healthy people or present in the patient with ulcer in the stomach sometimes can be the causative agent for cardiovascular disease, as well as Mycoplasma pneumonia and Chlamydia pneumonia, which they are present in the lung. But those bacteria in the lung can have secondary involvement of heart by CVD. And number 4 and 5, which they are present in the mouth along with the infection and problem in the main place, which it is teeth and gingiva, can be the causative agent for CVD of heart also. So only one of these items we mentioned. We are a few sentences talking and showing you regarding Porphyromonas gingivalis. Porphyromonas gingivalis. This bacterium, which is gram-negative bacterium, is the causative agent for periodontal disease. What is the meaning of periodontal disease? Any infection of mouth, especially teeth and gingiva, we call as periodontal disease. Periodontal disease is a chronic infection disease, associated with a variety of bacteria, which can cause damage to periodontal support structure and affect a variety of systemic system disease, such as cardiovascular disease. This bacteria is the most important pathogenic bacteria for periodontal disease. It can produce outer membrane vesicle. As you see, this is the bacterium. It is gram-negative bacterium. It is outer membrane. In some places, the outer portion of outer membrane have some invagination, the outside, okay, and then producing vesicles, which containing many toxins and enzymes. What is this? This is outer membrane vesicles, or OMV. So this bacteria, Porphyromonas gingivalis, is the most important pathogenic bacteria for periodontal disease. It can produce outer membrane vesicles, OMV, and release them to the environment. So where is the environment? The place of presence of bacteria is their environment. So they are living on teeth, they are living on gingiva, so they are present in the mouth. So they produce OMV and send it to our teeth, to our gingiva, and to our mouth. When this bacteria produce these OMVs, playing an important role in its pathogenicity. So this OMV is a virulence factor for this bacterium. Virulence factor. Virulence factor. OMV of this bacterium, when transferred by blood to heart, promote calcification of vascular smooth muscle cells in concentration dependent manner. So calcify the muscular smooth muscle. So this muscle, heart muscles, cannot pumping very easily after calcification. This OMVs from this bacterium significantly increase vascular permeability and enhances vascular edema, which mostly leads to the mortality of the patient. So you can see this bacterium is present in the mouth that produce OMV in the mouth, and it goes to the bleeding, it goes to the blood, and it goes to the heart, and by calcification of muscles and by production of vascular edema may be causative for mortality of the patient. In this figure, we can see production and regulation of OMVs of this bacteria. After the cell wall exists, phospholipids accumulated in the outer membrane leaflets, and the expansion pressure continued to produce, which intensified the further enrichment of outer membrane components The linkage between peptidoglycan and the outer membrane layer is disrupted. And finally, OMVs are formed. So what are we talking? We are talking in chronic infection. Even though infection can be dangerous and destroying, the main part of attack, sometimes it can attack to the other parts of the body. And when it continues for a long time in chronic infection, this damage continuously has the potential for killing the patient. Another definition we want to go through it is the definition reservoir. Reservoir. Where pathogens persist. Where are the pathogens in the world? When we are talking related to the pathogen, we are talking about human pathogen, because we are talking related to the medical microbiology, okay? Medical microbiology, and mostly because we are teaching advanced bacteriology, so mostly we are talking about medical bacteriology, which the center is human, and whatever is around the human are different infections which we are talking about. Sometimes we have a definition with the name of source, individual or object from which an infection is actually acquired. So sometimes we are talking related to the source of infection. Source of infection, individual or object from which an infection is actually acquired. Sometimes we are talking related to the reservoir. We want to see what is the meaning of reservoir. A reservoir is any site where a pathogen can survive until its transfer to a host, susceptible host. Often pathogens multiply within their reservoirs. So pathogens sometimes can find reservoirs, and they can a little have multiplication, and they are waiting there to find suitable host, suitable sensitive host. We can divide them into groups: living reservoirs and non-living reservoirs. Living reservoirs and non-living reservoirs. Living reservoirs like what? Sometimes humans, animals, birds, arthropods are all common reservoirs, don't always manifest illness during the pathogen they are harboring. So when a pathogen is present in human, animal, bird, or arthropod without any signs and symptoms, that at the same time, these pathogens can multiply and can transfer from these sites to sensitive hosts. We call them, they are reservoirs. They are reservoirs. And sometimes reservoirs are not alive. We call them non-living reservoirs. Include food, air, soil, and water. Sometimes microbes are present in food, air, soil, and water. They are alive there. They are alive in non-living reservoirs and waiting to find suitable sensitive host. Vomits such as cloths, utensils, and furniture are inanimate objects capable of transmitting infection. For a few minutes, we want to discuss more related to the living reservoirs and non-living reservoirs. Number one, when do we call human is reservoir? When do we call human as a reservoir? Humans are the reservoirs for many bacterial infections. Okay? And some instances, they are the exclusive host in nature to harbor the bacteria. When a human is colonized with a pathogen, don't forget, when a human is colonized with a human pathogen, but without manifesting disease, without signs and symptoms, he or she is referred to as a reservoir or carrier. So when one person has infection but there is no signs and symptoms, never he understand he has problem. Never he goes to the physician. Never he use medicine. But at the same time, these infection containing many pathogens can transfer from human reservoir as a carrier to the other sensitive people. Passive carriers carry pathogens without ever having the disease. So sometimes for a long time or in total there is no signs and symptoms, and this person is only carrier, never feel this disease, the related disease, never this infection show itself in the person, but in the whole time this person which is passive carrier can transfer infection to the other people. For example, the deadly meningitis caused by Neisseria meningitidis is often transmitted by passive carriers. So many people in the world have infection with Neisseria meningitidis, that they don't have meningitis, and as they don't have signs and symptoms, don't go to the physician, but at the same time they can transfer Neisseria meningitidis to the other people. So the deadly meningitis caused by Neisseria meningitidis is often transmitted by passive carriers who harbor the bacteria in their respiratory tracts. An incubatory carrier is a person who is harboring and can transmit an infection during incubation period. What is the incubation period? From the time one pathogenic microbe can penetrate to our body till the time of starting signs and symptoms. So from the time infection starts till the time showing signs and symptoms, there is a time. There is a lag, which we call it incubation period. In many cases, people which they are in incubation period without any signs and symptoms transfer the bacteria to the other people. We call them incubatory carrier. Passive carrier, it was for whole life, don't show signs and symptoms, but transfer microbe to the other people. It was passive. Incubatory, before starting acute phase, in incubation period, pathogens transfer from infected person to the other people. Another example, sexually transmitted infections. Sexually transmitted infections are frequently transferred by individuals who haven't yet shown symptoms. Many people in the world may have sexually transmitted infections, but without any signs and symptoms, and very easily can transfer it to the sexual partner by they can transfer it very easily, but the other people may go through acute infection. Convalescent carriers manifested symptoms of an infection disease in the recent past and continues to carry the organism during their recovery period. Active carriers have completely recovered from the disease and harbor the organisms indefinitely. For example, Salmonella, especially Salmonella typhi, the cause of typhoid fever, is an example of a bacterial infection that can produce a prolonged carrier state without the individual being aware of the condition. Salmonella can lurk in a quiescent state in organs such as gall bladder, sometimes even permanently. These individuals may continuously transfer the pathogen to their contacts, to the people which they are in contact with them. After human reservoirs, sometimes we are talking related to the animal reservoirs. Animal reservoirs. So some animals can become infected with those pathogens which are related to the human. Infections acquired from animal reservoirs are referred to as zoonoses or zoonotic disease. So again, what is the zoonosis or zoonotic disease? If the source of infection is an animal and pathogens transmitted from the animal, infected animal, to a sensitive human, so we call it zoonoses or zoonotic disease. Humans acquire infection from animals either by direct contact, as in the case of pets or farm animals. So there are very close contact with pets, for example, small dog, small cats, or horse, or another animals, by ingestion of the animal or inhalation of the bacteria in around its height, or through an insect vector. Sometimes there is a vector and it transfers infection from animal to the human through an insect vector that transmits the pathogen from animal to the human via a bite. Diarrhea caused by Salmonella can occur after handling turtles. So those people which have working with turtles, they are in high risk to be infected by Salmonella and contaminating one's hand with their feces, or from ingesting undercooked chicken contaminated with bacteria. If we eat undercooked chicken contaminated with Salmonella, we go through salmonellosis. From where it comes? It comes from chicken. Chicken is an animal. We eat uncooked or not completely cooked chicken, or through other routes such as eating undercooked or raw chicken eggs. We can get salmonellosis by eating chicken eggs. It comes from animal, yes? The disease tularemia. Tularemia is another disease caused by the organism Francisella tularensis. Is often seen in individuals who have recently skinned rabbit. So those people which are working with rabbit are mostly susceptible to receive infection of Francisella tularensis. Similarly, anthrax is another disease caused by Bacillus anthracis. Follows either inhalation of spores from dead animals or hides, or entry of spores to wound. Okay, so Bacillus anthracis came from animals, hides, and if their spores come to our wound. So after human reservoirs, sometimes some pathogens are present in animals and waiting in different ways come to our body and starting infection. In previous page, I told you sometimes an insect or arthropod are present for transferring the infection from animal to human. So the instrument, this instrument of transfer, we call as vector. We call it as vector. Live animal that transmit an infection agent from one host to another one. Like what? Like some arthropods, fleas, mosquitoes, flies, ticks. And it is so in Lyme disease, which the causative agent is Borrelia. And the vector is tick. Tick is the vector. After human as reservoir and animal as reservoirs, sometimes arthropods are reservoirs. Arthropod reservoirs. Arthropod reservoirs include insects and arachnids. A vector is commonly understood to be an arthropod that is involved in the transmission of the disease. Common insect vectors for bacterial infection include fleas, lice, and flies. Arachnid vectors include mites and ticks. The disease caused by the bacteria, for example, Borrelia, which include relapsing fever. Relapsing means repeating. Relapsing fever means fever which repeated many times according to the presence of infection like Borrelia. And the disease referred to the United States as Lyme disease. So the disease related to the Borrelia we call as Lyme disease. After it was discovered in Lyme, it is a place, infected ticks. So ticks are infected by Borrelia that take blood meals from an infected deer or mouse. So deer and mouse are infected with Borrelia, and tick wants to receive blood. So tick going to these animals and then receive Borrelia during drinking blood and then transfer it to the human. These ticks then injects bacteria into a human sometime later during another blood meal. Other bacterial diseases caused by arthropods include epidemic, murine, and scrub typhus. So typhus are in different types. So as you see, the most probable in BSc, you understood different bacterial infections. So here we don't have time to go through explaining the clinical syndromes, treatment, epidemiology, and the other things. So mostly we go through the definition, important definitions which needed according to the syllabus. So if you didn't know what is the Lyme disease, what is the recurrent fever, and these things, you can go through net or book and read it. But for examination, I ask you whatever I explain, okay? I ask you in the examination whatever I explain. But for your knowledge, it is needed to review whatever you understood before, or maybe you need to understand something which you didn't read before in BSc. So according to the time, to the remaining time, we should finish the syllabus. So sometimes we don't have sufficient time to go through to teach all the things. All the things are not possible to teach. So typhus is a very dangerous disease, and it is in different types: epidemic typhus, murine typhus, and scrub typhus. The causative agent of the disease is rickettsia. And epidemic typhus transmitted by lice. Murine typhus is transmitted by flea. And scrub typhus is transferred by mites. So you can see that different types of typhus have different types of arthropod, vector, and reservoirs. Another disease is Rocky Mountain spotted fever. Rocky Mountain spotted fever, also caused by rickettsia and carried by ticks. Another disease is bubonic plague, carried by fleas. So here you understood that different types of insect vectors like fleas, lice, flies, as well as arachnids like mites and ticks are present as arthropod reservoirs and as a vector device for transfer infection from one person to another person, from infected person to a susceptible, sensitive person. Okay, to see what is here in this table, here showing you that there are different types of reservoirs. What are they? Human, animal, arthropods, air, soil, food, and water. I explained sometimes human is a reservoir, doesn't show signs and symptoms, but contain typhoid fever, contain syphilis, and very easily can transfer to the other people, and they go through dangerous disease and may go to die. Sometimes animals are reservoirs, like what? Like anthrax, which animal is cow, salmonella, animal is turtle, tularemia, animal is rabbit, Lyme disease, white-footed mice. Arthropods, Rocky Mountain spotted fever by ticks, endemic typhus by fleas, scrub typhus by mites. And now we want to go through air, soil, food, and water to finish this lecture today, okay? Now we want to see what are about air, soil, food, and water. They are not alive, non-living reservoirs, non-living reservoirs. Like what? Number one, like air. Sometimes bacteria are present in the air and can be transferred to a sensitive human host. Air can become contaminated by dust or human respiratory secretions containing pathogenic bacteria. Suppose one person has Mycobacterium tuberculosis and doing many coughing and sneezing without covering mouth and nose by mask. So each time by coughing and sneezing, many aerosols, many small particles come to the air full of bacteria. Bacteria don't multiply in the air itself. Why? Because air doesn't contain substrate needs for metabolism. Air is not a good place for metabolism, for growing, for multiplying, but it is good place for transfer. So air is used only for transfer of pathogens, but air is not a good place for living, for residence of the pathogens, but may be transported by air currents to areas more conducive to their growth. Infections acquired through the air are characterized as airborne. If I get disease and infection come to my body with help of air, according air reservoir, we call it airborne. The classic airborne bacterial infection is tuberculosis, Mycobacterium tuberculosis. So as you know, Earth contains three parts: soil, water, and air. Earth non-living parts are only three parts: soil, water, and air. Air we discussed. What's about soil? Many pathogens are present in the soil. Many pathogens are present in the soil. Soil is typically a reservoir for bacteria that form spores when not in a host. The various species of Clostridium can be acquired from exposure, a wound, to dirt or soil. Why when you are doing, when are you playing football, if you crash to the soil or ground and there is bleeding in your hand or foot, immediately clean it, immediately disinfect it. Why? Because you know some dangerous pathogens are present in the soil, and if they can penetrate to your blood, can be life-threatening. So it is because you know soil is a non-living reservoir for many pathogens. These anaerobic bacteria cause tetanus, botulism, gus gangrene. Another example is anthrax spores can survive for as long as 100 years in soil. If one infected animal is in front of my house and it has anthrax, for 100 years anthrax spores are present there and can be infective for people. Heavy rain, excavation, and tilting may bring them to the surface and cause an outbreak of anthrax among domestic animals, livestock. In medieval Europe, specific pastoral were avoided for domesticated animals grazing. In some parts of Europe, which those soils may contain the spores of anthrax, those people don't allow domestic animals grazing there because of the risk of anthrax. The other one is water. You know, 2/3 of the earth contain water. Generally becomes a reservoir for infection when it is contaminated by soil microbes or animal or human feces. Raw sewage may contaminate drinking water during a storm or flood when sewage systems are overfilled, or if they inadequately treated and dumped into local waters. There is also concerns about the potential for terrorists to use water as a reservoir for bioterrorism pathogens. So, you know, the most important thing for all people in the earth is finding sufficient drinking water. and we receive drinking water by wells or rivers. And if terrorists, because terrorists knows water can be non-living reservoir, so terrorists may contaminate rivers or wells to infect people there. You can see pathogens can come from animals or from feces of animals to the water, can come from sewage of human to water, can come from agriculture and sewage dropped plant to the water and contaminating water which we are dependent for drinking. Okay, so we are on page 50. It is sufficient. Please next time inform me to start from this page. We are on the page 50 and food remaining to explain to finish this part. Okay, food as another non-living reservoir. If there is any question, please ask me.